This is Dr. Michelle Powell, and today we're going to address the issue of dementia and memory loss. Memory loss is really important, especially as you age, to be aware if you're suddenly getting, foggy brain. That is, you're walking into a room, you're not remembering things, someone gives you a name and you don't remember the name. And there are a couple steps that you can take to actually improve your memory and, if necessary, identify if you need to seek additional help to check to see if you have dementia or Alzheimer's. Join me on my class, Memory and Dementia. Anybody else have a concern about their memory and why? Yes?
Yeah, I'll think of something and go in the room and forget about what I thought about.
Anybody else? You walk in a room and all of a sudden, blank. Short and long. Okay? Short meaning you meet on the street or at a party and they say to you, "Hi, my name is Susie," right? You walk away from Susie and you start talking to your friend Jane. And she said, "Who that girl over there you talking to?" And you say, "Doo-doo-doo-doo-doo. Doo-doo-doo-doo-doo. Oh, yeah, that was Susie. I just met her. She's a cousin of Jane, and she brought her to the event today." That's in the short. That's the short. Something that happened just now. Or better yet, you need some ingredients for a cake that you're cooking, right? You don't remember how it's done, so you pick up the phone and you call grandma or your auntie or your cousin and say, "Hey, what was that? There's a special ingredient you put in that cake. What is it?" And she says, "Okay, you got to add cinnamon, but you got to ground the cinnamon." Okay. Hang up the phone. You go back to your cake and you're sitting there, "What was that thing that I had to put in that cake?" And then you wait for a second and it comes, "Oh, that's right, cinnamon." Short. Just got the information. It just went into the brain. It played around for a short term. Now, next year at Christmas when you try to bake that cake and you knew there was a special ingredient that had to go into that cake. And you're thinking, and you're trying to remember what Susie told you last Christmas to put in the cake. And guess what? That's right, it was cinnamon. You move this short, immediate information, to a storage place. And you got a storage center somewhere that you dump some things in for years.
Really?
You have not even looked in that storage place in years. And then one day you're in your house and somebody comes by and say, "Hey, you got a pressure washer?" And you say, "I got a pressure washer. I put that baby in my storage unit." So you did two things. You remembered that someplace you have something. That's your storehouse. You had put it somewhere. It's still there. It didn't go anywhere. So when things go from what we call immediate space to the storage unit, it's not in your house anymore. It's now moved to the storage unit. Long term. Another long term.
Say for the people in the back.
Long term. It's important that things that you really find important, like your name, your phone number, your social security, when you get it, that you spend some time with it so that it moves to long term. Because Susie that you met at that party, when you go home, you're not going to remember Susie's name. You're just not. And there are different ways to improve memory. And one of those ways is repetition. You must repeat the things you want to remember. We often forget because we're not repeating, we're not doing it anyway. I can tell you right now, I can get in my car and sometimes I don't know how to get home. Because my brain is on something else, but I get home. Because it's in my memory. I'm driving, I'm seeing, but it's not at the forefront of my brain because I know, I go there, I drive there. I've been going to the same place over 6 years. It's moved to long term, yes.
You're driving on automatic.
Exactly. It's almost things you do automatically. I can tell you right now, if you were just to stop right now, and if you were to just pretend you have a toothbrush that you want to brush your teeth right now. Pretend you have a toothbrush, it's on your desk right now. I want you to reach for that toothbrush. The hand you reach for, you always reach for the toothbrush with. You always. Pretend you have a comb that you want to comb your hair with on your desk. Reach for that comb. It's the hand you always reach for. If you take your shoes off right now, I will guarantee 99% of you will put the same shoe on first. It'll be the left and the right, or the right then the left. Because you do it over and over and over again. Repetition is one of the most important means to store from short to learn. So when you meet Susie, new people, and this is good for anybody, doesn't matter your age. Hi, my name is Michelle. What's your name? Susie. Oh, Susie. Hey, Susie. That reminds me of my aunt. Her middle name was Susie. And come to think of it, I went to grade school with a Susie. Did you go to St. Mary's by any chance? My girlfriend in elementary was Susie. And come to think of it, on my choir we have a Susie. That's a great name. Who gave you that name? Oh, that's my auntie's name. She gave it to me. Oh, so Susie, your auntie gave you your name. Her name was Susie too. How many times did I say Susie's name? 8. At least 8 times. But I did something that's really valuable for memory. The first one I told you have to do to improve memory is repeat. Repeat, repeat, repeat as much as you can. Brush that teeth, left to right, brush that teeth. Comb my hair, left to right. Susie, 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 hey Susie. But then I did something else. And the second most important thing for memory that helps improve memory is link. I did it with Susie. I said, Susie, oh my gosh, I had a grade school friend whose name was Susie. I linked it to something that was in long term. You want to link a short to something long. So it's like a hook. And then it pulls it from short to long. So I took Susie, who I just met, and I hooked her into my grade school. And then I hooked her into my aunt, who's also Susie. Her aunt, who's Susie. And then the third thing that will help you, besides linking, make a story. Make a story. A story is like a bond. You ever meet somebody who maybe worked for the school board, or maybe worked in a job that you worked in, and then all of a sudden, oh man, you worked down at Alapata? I worked at Alapata back when I was in grade. What year were you in Alapata? Or you were the school board system? When you worked for the school board? And now you've created a story that links the two of you together, and because your time at the school board was long, you got that hook. Does that make sense?
Yes.
So when you get new information, take it through repetition. Link it to something that's already grounded. Something that you already know, like brushing your teeth.
Yeah.
Link it to something like that. and then create a nice story around it. Okay? Like, yeah, I went down there. And girl, let me tell you, that girl, Susie, I had in grade school, she was nuts. They had to kick her out. You know, she didn't like wearing her uniform the way the old sister nuns liked it. You know, so she got kicked out. So I haven't seen Susie. You're not that Susie, by the way. And so you create the story.
Yeah.
It will, I'm telling you, try it this week and see if you don't improve your memory.
Yeah.
Right? So we're going to take you through repetition. We're going to link it to something that we're grounded in. And then we're going to create a story. And guess what? The funnier the story is, okay, or emotional, the more likely you'll remember.
Yeah.
We are emotional beings.
Yeah.
If Susie made you cry when you were little because she pushed you down,
Always remember that.
I don't like you because you remind me of Susie.
Always.
And Susie pushed me down. I never forgot how she skidded and tore my new dress, and I liked my new dress and and after she pushed me down, it was dirty, and all the kids laughed at me. And here you are, 60 years old, getting all teary-eyed because you met somebody named Susie, who looked like somebody who had the same name, who pushed you down and messed up your nice dress.
That's true.
Linking emotion. It's the same reason why sometimes you just met somebody and you don't like them. That ever happened to anybody? Just met somebody and you swear it has something to do with their aura. They got some aura. Ain't got nothing to do with their aura. Their hair color probably the same color some of you don't like, or the way they belch or burp, or their eyes spaced out, you know, their teeth funny like somebody you don't like. You know, or they have an accent that's from someplace you don't like, and you've attached it, you've linked that new person you don't know nothing about. You've linked them and created a whole story. You met that person 5 times, you walk up, girl, you know, I met over Susie. Let me tell you, I don't think I like Susie. I don't like her. She gives some bad vibes. She gave me a little bad vibe. But you just met Susie. This is just some bad feeling I got about her. Yeah. You don't tell your girlfriend that she reminded you of the woman who stole your ex-husband. Whose name was Susie. Okay? So she gives you bad vibe, not because she just, you know, spit in your cup of drink. No. She's reminded you, you've linked her, and a story that goes with it that was really emotional, right? Really emotional. So write this down because it's really important. If you're forgetting a lot of things, it's because you're not taking the time to repeat, to link, and make a good story about it. Okay? Now, what if, Dr. Pye, I did all this, but I still walk into rooms and can't remember stuff? Now let's do some investigation. All right? Now let's get into reasons why you may have some issues with memory. Okay? We were talking a lot about short term. This is for short. But why I can't remember my grandbaby's name? Maybe you don't like her, but that could be something else. Memory has a lot to do, especially long term, is the attachment we give to it, right? One of the things before you start chasing that you're getting Alzheimer's, the first thing you want to know, am I paying attention? Okay? Am I paying attention? You remember when you're talking to the kids? Listen to me. I tell you, listen, because you're going to get there and you're going to forget. Are you paying attention? And I mean really giving your attention, not watching the TV, looking on your phone, cooking the dinner, or what have you, when you are making a decision about something. Pay attention. The second thing that you have to check on is, am I really paying attention to it? And how do you know if you're paying attention? We pay attention to important things. If someone told you, I'm going to your bank account, I'm going to take $1,000 out of your account. What you talking about, Willis? All eyes on it. Oh, what you talking about? But if they told you, hey, you know, I was walking and I found a penny on the ground. Okay. You'll be asked, what did she, what was it she, no, it was some stupid petty, you know? Pay attention. Are you paying attention? The second thing you want to think about is, and a lot of people aren't aware of it, is that medications. Before you start chasing, I got dementia, take a look at the medications you may be taking. There are a lot of medications that affect memory. Okay? For instance, sleeping medications. A lot of people like to take Benadryl at night. I'm telling you, Benadryl, if you don't give it those 8 hours to work through your system, get up and you may be cooking stuff you don't know you're cooking. Okay? Ambien does that. They had to put a warning and reduce the dose for women because a lot of people walking dogs, driving out to parks and cooking food, taking showers, and didn't even remember because it was affecting their memory. So take a look at your medications. Ask questions about your medications. If you find all of a sudden you were sharp as a tack and you got a new medication and after a month or two you're like, Many medications related to mood, anxiety, depression. One of the side effects can be memory. Not permanent, because when you stop it, oftentimes the memory will come back. Yes. Yes, please.
If you know, you're the doctor.
Yes, ma'am.
You know.
Yes.
Why did you give it to them?
So, here's what I'll tell you. Good question.
Yeah.
Why are things prescribed to patients that we know have side effects?
Yes, Lord.
Okay. Let me answer that really quickly. The side effects far outweigh or diminished compared to the problem. So, for instance, I have people who can't sleep. They're not sleeping not 1 day, 2 days, 3 days. They haven't slept a good night's sleep in months.
What?
Hey.
And they're crappy pappy. They're walking around miserable, pissing people off, forgetting things. Lack of sleep contributes to memory loss. Right? So here's the thing. They come to me, Doc, it's too much. I can't not sleep. I'm up with the pain. I'm thinking about stuff. You know, everybody in my house is pissed off at me because I get nasty in the morning because I haven't slept all night. And I can't do anything because I'm tired all day. The problem outweighs the side effect. And that's the thing physicians always have to weigh. But what I do as a provider, I make you aware of it.
Oh.
We're not going to be on this till kingdom come. I'm only giving you this treatment, like for sleep, for the short term until we get to the bottom of your sleeplessness. Why are you not sleeping? Until we work out the discipline of sleep. Lack of sleep is a symptom. It's not an actual problem. We have to wrestle with the source. But in the meantime, I need you to get some sleep so you can stop pissing people off and stop telling me every time you come here how tired you are. Okay?
Yeah.
So that's why we often have to weigh, is solving this problem going to be better than the side effects? Because everything has side effects. Everything. Yes.
I'm interested in line dancing.
Yes.
And I went to take a class with line dancing, and boy, I was lost. I'm saying, okay, so I'm trying to think, okay, how many steps? Then that by the time I think of that, big
On another step. How can you help that? What can you do for that? So her question is, she's trying to do a line dance class, and it's for line dancing. It's for even learning a computer program. The key in the case of line, I'm going to do dance because dance can be complicated. First thing I want you to do when you go to class next time, put your phone and record the class. Record the class so that when you get home or when you have some free time, you're going to play, stop. play, stop. And then you're going to do what we talked about. Repeat, repeat, repeat until you get the entire dance down. Okay? So you're going to repeat, repeat. So record it, stop it, record it, stop. And that's with anything that you're trying to learn for new. We're going to take it to repeat. Right? So we're going to program it and stop it. And it's okay. But remember, when you want to learn something new, baby steps. Don't go into advanced line dancing and it's your first line dancing class. You know, not like I do with the Excel class. I walked in Excel 2 and I should have been in Excel pre-1. Not even 1, pre-1. Okay? So let's go on. Pay attention to your medication. Read the side effects. Is one of them sleeplessness? Even the vitamins that you're on. Okay? For instance, aspirin. It's over the counter. It's not vitamin, but it's over the counter. Aspirin can cause bleeding. Okay? If you have a weak stomach, the lining of your stomach, that's a side effect. But guess what? If you have a condition called atrial fibrillation, or you've had a stroke and you don't want to clot, not having a stroke far outweighs the fact that I may bleed. And I'm going to do things not to bleed, so I'm always going to have something in my stomach. I'm going to take my stomach medication so I keep the lining. I'm not going to vigorously brush my teeth like I'm trying to get the tartar off myself, you know, so you don't end up bleeding gums. So are my medications doing it? The other things you want to think about, hormones. Where are my hormones? We know that as we get advanced in age, our hormones change and fluctuate. Check your thyroid hormones. The thyroid can be affecting and affect memory. Check your estrogen. Check your testosterone if you're a male. Those hormones can contribute to memory. Other things to evaluate. Is it really memory loss? What is my emotional state? Did you know when people are depressed, they often forget a lot of things? If I'm depressed, and that's intentional too sometimes, conscious and unconscious. When you're in a depressed state, you don't remember that, oh my gosh, I got a beautiful house, I have 4 children, and you know, I got a nice job that gives me a paycheck to pay my light bills. No, I'm just in a depressed state. All I know is what I feel. And forgetting everything else. And you move into a forgetful state. And as I touched on, what is my sleep patterns? Okay, wake, sleep, sleep for 2, wake for 4, sleep for 1, wake for 5. If you're not sleeping, you're not allowing your brain to rest. Your brain needs rest time for rejuvenation and for processing.
Yes.
Not that like it stops working. It's working. But you got to give it that downtime from stimulation. So clean up your attention. Look over your medications. Evaluate your hormonal states if the rest are okay. Check your emotional state. You may not want to remember because it was just a bad experience. And you know, I'm going to forget 2022. That's just a whole year that could have done without. Some people have years like that, where they've just abolished the entire 3, 4, 5 years. It was so traumatic. Can't even remember where they lived. Not because it's not in long term, but because of the emotional connectedness to it. And evaluate your sleep patterns. You do all that and you say, well, no, those are not really the issue. I'm still not remembering. Now you want to get investigations, medical investigation going. This is now when you want to see the health professional of a psychiatrist, a psychologist, a physician, to do what we call, and a neurologist to evaluate, do you have a condition called dementia? dementia. And it can start pretty much at the average age is about 60 and over, but it can start earlier. And one type of dementia that shows up is Alzheimer's. And my aunt had Alzheimer's very early, very, very early. I don't think she was 50 years old yet. I was still a resident, and my family came to me and said, something's wrong with my aunt. And I'm like, what do you mean something's wrong with her? She looks fine to me, you know? And that's how it presents. They'll look fine. But she was a lady who traveled a lot. And when she traveled, she's from Jamaica, her suitcase would be filled with all sorts of things to take back. And she was forgetting the things that she was packing. And so I took her in to get evaluated. And one of the things that they found out on the evaluation, they said, I want you to make a clock and put the hours on the clock. And all the numbers on one side of the clock. She had forgotten to space out the numbers on the clock. It was a very simple and subtle thing. But with Alzheimer's, it's a dementia that is progressive. I call it the forgetting disease.
Me too.
You forget, you start forgetting. But it's not just forgetting people and faces. One day I found her in the shower after she was to go take a bath, fully clothed. She had forgotten that when you go into the shower, you have to take your clothes off. One day with one of my newborn babies, she was there with the baby, and we came home and we couldn't find her. She was in the closet with the baby because she was watching television and they were shooting on the TV. And she forgot that it was a TV and it wasn't real.
Something else.
So you start having the forgetting disease. And as she progressed, she forgot how to put on a seatbelt. So we would have to put her in the car and put the seatbelt on for her. To the place where after time, and this is usually a span of anywhere from 6 to 10 years, she forgot how to feed herself. And then you forget how to breathe. And she did pass, but it was a progressive thing. And it's slow. And it's slight. And if you're not paying attention, it can slip right by you. Anybody who's had Alzheimer's in here? Progressive?
My brother.
Your brother. And it's very painful to the people who have to engage with these family members simply because they're not noticing that they're forgetting. And sometimes you remind them, they'll look like, what are you talking about? What are you talking about? And may become angry. Moods may change. You may get violent behaviors, anger, and it's not personal. I have a gentleman in my practice who's been with his spouse and totally forgot they're married. The daughter who's taking care of her she didn't remember the daughter taking care of her, but she remembered the daughter who wasn't taking care of her. And it's like that. It's like that. And it's not personal. And if there was one message I could give to people who have family members, it's not personal. They're not intentionally forgetting you because of something you did. It is an act of the brain, and the brain is having spots, and over time it's having more and more spots. Gaps is a better word.
It's like they're learning backwards, like unlearning.
Unlearning. Yes, that's a good way to think of it. The unlearning. And it's all on, and it's not intentional. So if you do have someone in your life who is starting to demonstrate a loss of forgetfulness, don't make it personal. They're not doing what you ask. They're not getting angry because it's you. And that's the hardest thing to do, especially for caregivers, is to not take it personally. I'm here 8 hours a day, 10 hours a day. I'm feeding you, bathing you, dressing you, and you can't remember my name. You know,
No problem.
you liked her better than me. That's why you can't remember my name. And that's not even true. It would be nice, but it's not even true. Yes.
Is there a difference? But I heard there's a difference, like dementia and Alzheimer's.
It's a form of,
Form.
if it's a form of, and this talk today is very limited, but there's so many forms of dementia, and the reason we, I guess, throw it in a big basket, because many of the symptoms show up the same, which is the small loss and forgetfulness of things. Small. Some are drastic. A person can have an injury, a head injury, like they call it traumatic brain injury. You know, in a car accident, damage gets to the brain, and whole years are absent. Things are just gone because that part of the brain has been damaged.
And then some of them remember the old stuff.
Yes, because they're in long term.
Oh.
Long term is harder to forget than short term. And that's one of the things you really want to pay attention to. You're doing repetition, and nothing you do is helping you to get it into long term. You really want to investigate. Take some investigative work. Yes, ma'am.
But junk food, the type of food you eat, cause memory loss.
For sure, some alcohol can really get rid of that. I tell you now, if you want to forget, I'm going to drown my sorrows. You heard that? The question was, can junk food or certain foods affect your memory? And we don't like to call alcohol a food, but you sure going in your body like food. Alcohol definitely can affect your memory. Marijuana can affect your memory. Okay? I know people walk in the kitchen and be standing there. Young people, what are you doing? They've forgotten why they're there because it has affected the memory. And there are very good things for marijuana in the medicinal realm, but side effect is memory loss. And they may not want to acknowledge it. And the more you use certain drugs, the more memory lapses you have. Seizures. People who have seizures can have periods of times that they don't remember because of the seizure. Okay? And so back to foods. Are there foods? Yes. Toxins. Anything that's toxic to your brain can affect your brain. Okay? So you want to avoid things that are toxic. Okay? Things that are good for your brain. The Bs, I love the B complexes, the B6, the B12, the folic acid, thiamine, all those things are good for the brain. A B complex is one of the things I always prescribe for people who are concerned about their memory because it helps to build the nerves, your B complexes, okay? If you have any problems with your stomach, sometimes your Bs are not absorbed because the lining of your stomach is impaired. And that's when it's better to get the injection for your B, like the B12. Okay?
Is Prevagen, is that?
Yes. There are new medications, and I won't go into them, but one of them is Prevagen, which we just talked about, was the question, is it good? There are a couple of meds that have just come out that we have found is delaying the progression. Remember we said with Alzheimer's, you're progressing backwards. And that progression is the work they're working on now. And a drug like Prevagen is doing that. It sort of slows the progression. And the longer we can slow the progression, the hope is we find the cure. You know, we find the cure. But for your memory, and this is what I want to leave you on. You're here now, there are things you can do. First, be active.
Yeah.
The more active you are, the more repetition you engage in, the more you use your brain. Puzzles, search words, you know, dancing, learning new things. Stop, keep doing the old things you do. Take a different road home. Seriously, take a different road home for a couple times so you put down new pathways in your brain.
Yeah.
Try something different, a new language. I'm too old to learn a new language. I ain't got it. No, learn a new language. It'll make your brain activate. Learn an instrument, a musical instrument. If you've always wanted to play the piano, start learning the piano. Anything new creates new brain cells and mapping, which helps to stimulate the brain. You know, forget the fear. Think I'm building my brain cells. So games, puzzles, new activities, new pathways home, you know, new conversations. Okay, stop talking about the same old stuff. Okay? Play a challenging game like chess, where you really have to think and anticipate moves. Okay? Exactly. Get that brain working. So, this is leaving with you. Evaluate your attention, medications, hormones, emotions, and sleep. And also go through the repeat, links, story, and make it funny. Yes.
I have two questions to ask. How much hours of sleep does one need?
Good question. The question is, how much sleep does anybody need? Well, 7 to 8 hours, 6 to 8 actually is on average, right? But this is how you detect, do I need, how much sleep I need? Because it's an individual thing. If you go to bed and you sleep, not wake up, sleep, but I mean sleep. Like you go into bed and you don't open your eyes until like 6 hours later. And you get up and you're like, oh, I'm tired. You need more sleep. Okay? If you wake up and you feel tired and you slept through the night, you need more sleep. Okay? So go to bed 1 hour earlier. Okay? And keep doing that until when you wake up in the morning, you're like, let's go. Let's get moving, Dave. Let's do our thing. You should be ready to activate when you wake up. You should be ready to get going and be cognitively ready to engage. Okay? Yes.
What about 3 or 4 hours later and you're ready to go back down?
Okay, so you have to evaluate. I get up, I feel energized, I feel good, and now 3 hours later, I need a nap. I have found the most common reason why people who have slept adequately find themselves going back and needing more sleep after just 3 hours. One, medications. What medications did you take that morning? Okay. Second, what is your emotional state? And that's the tough part. A lot of people don't want to evaluate their emotional state. Woke up, they felt good, they get a good night's sleep, but then after 3 hours, I ain't got nothing to do. I got nowhere to go. Ain't nobody calling me. And they're depressed. And sleep is often used as a tool to hide depression. And so we go, I'm just go back to bed. Because I don't have to think. I don't have to feel.
Somebody's aggravating the shit out of you.
You go back to bed. You go back to bed. Emotional state. Or you're angry or you're upset. We'll talk about sleep at another session, but many people utilize sleep as a tool to avoid emotional states and addressing emotional issues. And it's okay for the short term, but if you look at your life and you find that you're in the habit of using sleep to avoid living, and when I mean living means engaging people. It means engaging issues. It means having to solve problems. And you're using sleep to avoid that, you may want to seek a counselor to assist you so that you can use your life fully.
True.
All right. How much sleep you need till you feel good when you wake up? Feel good when you wake up. That's how much. All right, guys. Thank you so much. Please like, share, and utilize those new social media